Hello, this is in-bed proning technique using the Hovermatt air-assisted device. So for this technique, we're going to have a minimum of 4 caregivers available, one at the head to manage the tubes, lines, and patient's head, at least one on each side of the patient, ideally 2 caregivers on each side of the patient, and then 1 caregiver to operate the air supply and call out the instructions just to make it more simple. So when we prepare the bed for the patient and in-bed proning technique, we're going to have 1 Hovermatt as a bottom layer. You can see that this Hovermatt has been off-centered so that when we prone the patient using the top layer Hovermatt, that patient prones onto the Hovermatt and is actually centered on this lower level. The reason we have this down here is in the event that the patient needs to be supined immediately, we have a Hovermatt where we can use the exact same technique to do that, or to just center the patient after they've been proned, or just 48 hours later, 24 hours later, whenever the patient is clinically ready to be turned back to that supine position. So we've got our bottom layer. We're going to then add another Hovermatt as a top layer. This Hovermatt is going to be fully centered on the bed. And then we're going to bring our patient onto the bed. The next step is going to be we're going to secure the arm on the side that we're turning towards in the proning process. We want to make sure that that arm is nice and secure so it's not flopping around and doesn't get kind of out of position. So what we have here is just a disposable sheet. You can use a pillowcase, towel. We're going to get it underneath the patient using log roll technique, back and over the arm and back underneath the patient so that it's nice and secure. From there we're going to get our side rails in place. And then the next step is we're going to use the air assist to actually bring the patient closer to the side that we're turning away from. So I'm going to actually take our hose here, get a snap on the end of the hose, snap on the inside of the mat. And this is in either port. You'll notice that we're connecting to the side that we're turning away from. Connected, Velcro over the top. Then I'm going to use the adjustable speed button here to partially inflate and then fully inflate, and we can bring the patient over. Now I'm going to hit the standby button to deflate the mat. And the next step is to fully tuck the mat on this side underneath the patient to restrict the airflow. You want to do this head to toe so that there's no mat showing on the outside of the patient. With this airflow restricted, the mat's going to blow up on this side. It's going to give us the movement to start proning the patient. We're going to let the air do some work for us for a second or two, and then we're going to use the handles to help usher that patient over while the opposite caregiver is helping to kind of guide them down into that prone position. And then again, our caregiver at the head is going to manage everything up there. So for this proning technique, we're going to fully inflate using the full inflation button. I'm going to count off 1, 2, 3, and then we're going to go ahead and do that full prone. 1, 2, 3. I'm going to hit the standby button to shut off the airflow right away and disconnect. Alright, from here, we're a little bit off center, so we're going to reconnect to the bottom layer Hovermatt. Adjustable speed, fully inflate. Center that patient, and we're all set. So fundamentally, we haven't changed the in-bed kind of manual proning process at all. All we've done is really brought the air into the equation to help kind of move that patient initially into that prone position and usher them over, and then we've also used the Hovermatt to center the patient from here. Now this lower Hovermatt is now in place and can be used to supine the patient at whatever time that is clinically appropriate. So you've got your bottom layer in place, and that kind of covers the HoverTech in-bed proning technique. Thank you.